Hello everybody. If you're waiting for surgery on the NHS, you know that you're in for the long haul. The most recent data show that there are 7 million people waiting for investigations and treatment. This means that you could be waiting well over a year for your hip replacement surgery. There are some regional and national differences, but it's all pretty grim overall. Does the government have a plan? Well, it's developing surgical hubs to try and increase productivity, but these aren't going to happen overnight. In the private hospitals, we're doing thousands of NHS cases every month, and the numbers are growing all the time. We can't take on complex cases, and for people with medical problems, they have to go into the NHS hospitals, so there is a growing gap in provision of care. You don't have to just sit around waiting. In this video, I'll discuss some evidence-based strategies to help you stay as fit, healthy, and positive as possible while you wait for your surgery. I know all too well how difficult it is when you're in pain, tired, fed up and struggling, but taking control will make you feel better. You might remember that I did a video with ace physio Will Harlow recently. I've been reading his excellent book, Thriving Beyond 50, which is full of top tips to stay fit and strong. It's a great resource for everyone, so put it on your Christmas wish list. There's a link to it below. I know what you're thinking though, I can't even walk to the kitchen without pain. But research shows that even gentle movement can make a big difference. For example, low-impact exercises like swimming, cycling or chair-based workouts can keep your muscles engaged without putting too much strain on your hip. Strength training is particularly important. There was a study in the Journal of Orthopaedic Research recently that found that stronger leg and hip muscles lead to better outcomes after surgery. So use some light weights or even tins of beans in a bag and try some seated exercises for your thighs and glutes. I bought this cheap but very well made set of weights from Aldi, so you don't have to spend a fortune on them. Take things slowly and gently at first until you gain confidence. You'll be surprised at what you can do. I'll put a link to the NHS website that has some exercises for you to try at home. Talking of food, let's look at nutrition and diet. While you're waiting for surgery, it's the perfect time to optimise your diet. Here's what I suggest. Protein-rich foods to maintain muscles, chicken, fish, eggs, and plant-based options like lentils. Add things like chia seeds to porridge. Eat anti-inflammatory foods like berries, nuts, and leafy greens. They can help to reduce pain. And I know I bang on about it a lot, but don't forget about vitamin D for bone health. I think most of us should take vitamin D during the autumn and winter, more so if you have poor mobility and don't get out much. What about managing pain? Finding the right combination of drugs is tricky, especially if you're already on medications for other medical problems. For most people, simple paracetamol or anti-inflammatories like ibuprofen, diclofenac and naproxen work very well. Your GP will advise you on what's best for you. Have you tried hot and cold therapy? Heat packs can help to relax tight muscles, while cold packs reduce inflammation and can be soothing, particularly after exercise. Some people find mindfulness and relaxation techniques helpful. Some studies have shown that mindfulness can reduce the perception of pain, and apps like Calm or Headspace are useful places to start with this. To help deal with the frustration and negativity, there are other things you can do as well. It's normal to feel frustrated, but staying positive can really help keep you on track and even help your recovery. Keep to a routine every day. Make a plan to eat properly, do some exercises and look at what needs to be done in the house to help with your recovery. This could mean bringing a bed downstairs so that you've got it ready for when you come out of hospital. Look at trip hazards like loose rugs and cables, and even preparing food to put in the freezer so that you don't have to think about cooking when you get home. Some people find online support groups helpful. There are plenty on Facebook and forums like Healthunlocked, but I know that they aren't everyone's cup of tea. I'll put some links to the Healthunlocked below. If you're really struggling to cope, your GP might recommend counselling or cognitive behavioural therapy. I know there's quite a wait for that though. And of course you must stop smoking and cut back on the booze. The healthier you are, the quicker you'll get better after surgery. And of course it will help to reduce the risk of complications. So while waiting times might be out of your control, your health and mindset aren't. Every small step you take today, whether it's doing some gentle exercise, eating a healthier meal, or even a few moments of mindfulness, will make a huge difference in the long run. Practicing good habits now will definitely help you. I hope you found this helpful. If you've got any questions or comments, please leave them below. If you'd like to get in touch, the details are in the description. Thanks for watching. See you all again soon.